it's your dentist. I'm going to explain to you something so near and dear to us dentists. I'm going to talk to you about floss. Why is it so very important? First of all, if you're going to visit your dentist regularly for your checkups and you're not flossing daily, give yourself a pat on the back anyways, because at least you're trying to take care of your dental health. But since you're going anyway, why don't you just take the extra step to really maximize your dental health and just floss every day? Yes, it's useful for getting out the occasional piece of food stuck between your teeth, like steak, spinach, or popcorn. But in reality, this is how important flossing your teeth is. I'll put it this way. If you were marooned on a remote, hopefully tropical island without civilization and you had a choice to bring a toothbrush or floss, you should pick the floss. Yes, the floss is much better and more effective at taking care of your teeth. That's how important floss is. You might be wondering why this is. To understand that, we have to delve into the minutiae for a little bit. Bacteria are everywhere on our bodies, but bacteria love to live in your mouths the most. There's around 20 billion bacteria in your mouth. There are about 700 different types of bacteria in your mouth, and they reproduce every 5 hours. Even if you had obsessive oral hygiene and floss your teeth 3 times a day, your mouth would still be the nicest place to live for bacteria, viruses, and fungi. Yes, you have viruses and fungus in your mouth, but that's another discussion. Anyway, what's not to love about our mouths? It's warm and has plenty of food and water. Sounds a lot like a tropical island, doesn't it? And in the tropical paradise that's in your mouth, bacteria especially like to collect in little places where their homes aren't disturbed. Would you like it if someone came to your house and tore it down every day? I hope not. The best places for bacteria to hide is, number 1, the tongue, number 2, between your teeth, and most of all, in the little spaces where your teeth and gums come together. The seams where the tooth and gums meet are not airtight. Everyone has a little gap where the gums end and the tooth begins. Dentists call this gap pockets. Bacteria love to hang out in these pockets, and this is where they set up shop. Bacteria start to colonize in these pockets in small numbers at first. They're starting a little village, so to speak. Dentists call this a biofilm. If you don't floss every day, this biofilm grows into entire civilizations. There's been studies that show within this layer is a very organized strata of life. There's highways and byways where nutrients can flow and feed all the layers of bacteria. There's clusters of really bad bacteria mixed in with not so bad bacteria. Like a bad neighborhood in the city. Remember that game, Sim City? They build upon themselves, kind of like that. Once the bacteria build their homes, they really don't want to be disturbed, so they've evolved very clever mechanisms to avoid you bugging them. I don't mind the pun. Some bugs secrete chemicals that make them stickier. Some of them have extensions of their little bodies that look like hooks on Velcro. Most of them don't want you to know they're even there, so you don't have any symptoms at all. No pain, no idea. It's not in their interest to announce they're there, otherwise you would be getting rid of them. And because they worked so hard to build their little city. But your body reacts to these bacteria as an infection in a rather complicated process called inflammation, and it tries to remove them, mostly unsuccessfully. In the process of fighting off the bacteria, the tiny little blood vessels in your gums open up to the mouth or dilate to allow for the passage of large immune cells to fight the bacteria. Once this dilation occurs, small-sized red blood cells leak out of the mouth as well, which is why you get bleeding gums when you have gum disease. Over time, the clinical effects of this infection result in an irreversible loss of gums and bony support around your teeth. Think of it as collateral damage. All of this can happen without a single bit of pain until one day you realize your tooth is more loose than usual, and that's when your dentist gives you some bad news. Flossing or using the water pick daily keeps the bacteria from building their city. It causes chaos and disorganization of their building efforts and makes them start over every day. Keep in mind, too, that flossing also prevents cavities. Therefore, your mouth is much cleaner, your health will be better, your breath will be fresh, and best of all, you get an A+ at the dentist. Thank you for watching. I'm Dr. Nora-Vinh.